Good afternoon. This is Jack Broughton of Kemper Senior Solutions, and Happy New Year to all of you who are in attendance today. Hope you had a fantastic 2014. We're really excited for this year, for 2015 here at Kemper Senior Solutions, and really feel that we had a great year last year. Seen business kind of stay about the same, but one thing that was very interesting is that our product mix ratio on the home health care plan really increased from about 12 to about 22% of the total product sold was home health care. So this plan that we're going to be talking about today. So we really believe that we're starting to get a lot of traction. We're really excited about the Schloss and Fleming team being a part of this organization. They have been for well over 2 years. And we trust that this news that you're about to receive today will be good for you. I hope that it's going to be insightful and informative. I always like to begin on our presentations letting you know a couple of housekeeping items first. You may want to listen to this presentation again. I am recording it, and I will send the link to the Schloss and Fleming team. And just get a hold of them. I'll give you the contact information later. Plus, you may have other questions or comments to be directed to them, and they can send a link to you. I'll have it to the NNF team in about sometime this afternoon. So thank you so much for attending. My name is Jack Broughton. I kind of mentioned that a few moments ago. I'm the Vice President for Kemper Senior Solutions. In today's presentation, especially when you talk about a plan like this, there are a lot of state variations where the forms are different from state to state. The premiums vary somewhat, but there's not a lot of differences. The premium itself is very inexpensive and affordable to almost everybody that you speak to. I always try to kind of emphasize what type of plan this is and what it is not. I'll get to that in about the second or third slide. But anyways, what are we going to talk about today? We're going to talk about the home health care plan. We're going to talk about Kemper, their history of excellence. Also, we're going to get into a couple other items. We're going to talk about the outline of coverage on the plan, the basic plan itself, which includes the home health care benefit, the home health care aid benefit, the prescription drug benefit, which is a part of the basic plan, and the rates, the optional benefit rider, the benefits and the rates, the triggers, the home health care application and medical notice, and I'm going to end with miscellaneous forms. So let's talk about Kemper. Been around for a long time, well over a century. They have evolved into be one of the powerhouse property and casualty insurance companies in our country. They have acquired a variety of different other financial institutions, some life insurance companies. One life insurance company that they purchased was Reserve National Insurance Company out of Oklahoma. We'll talk about them briefly here in a minute. That company is the underwriter of this home health care plan. With over 6 million policyholders, these folks have put their faith and confidence in Kemper to provide them their insurance and financial needs. Kemper has over $8 billion in assets and employ well over 6,500 associates. The underwriter of this plan is Reserve National Insurance Company out of Oklahoma City, Oklahoma. Reserve National, along with Kemper, boasts an A-minus excellent rating through AM Best. Now, we've talked specifically that today, going over the plan, I'm going to be using Pennsylvania as the example and the forms that are needed to complete an entire packet in the state. You'll see first there's the brochure. Inside the brochure has got the rates and kind of a Reader's Digest version of the benefits. There's the first page of the OLC, the application, and the medical notice. Here I've got the 2014 Medigap policy guide. We'll get the 2015 one up there shortly. Now you'll see that I've got 3 check marks on the 3 middle forms. These 3 forms is what kind of consummate an application packet. When you talk to a client, these forms will accompany the application, and you get into the home office for approval. I will mention to you that the approval rate on this product is right around 97%. The vast majority of the people that you talk to who apply for this product will be issued. The Medicare Supplement Guide is a guide that needs to be left with those at 65 and older. It's not necessarily honed in to Reserve National or Kemper. A lot of companies have this, whether it be Medicare MAs or Med Sups or whatever it may be. So if you don't have any of these, you can get them off of the agent portal under the resource tab, and you can order them. It's on the supply form. All right. Now, let's look at Pennsylvania. Let's look at the OLC. I want to pull out one thing that is on page 1, and you'll notice in the lower left-hand corner of the OLC itself, it's got a form number, meaning it's specific to this particular state, and it's Pennsylvania. You're going to see that Texas and Georgia and Tennessee and the variety of different other states, in most cases, has a state-specific form. So the OLC is no different. You can see that kind of depicted in the lower left-hand corner of the form itself. Page 2. Well, before I get to that, on page 1, it kind of talks about the benefits of the basic plan. Page 2, you'll see I'm pulling out some things here. Two-thirds of the way down, it talks about the prescription drug benefit. It goes in detail on what it looks like for the state of Pennsylvania. Page 3, nothing too exciting I want to pull out here, but on page 4, so it's telling you right here that in Pennsylvania that there's 4 pages to the OLC. My suggestion is to get a copy of this from Schloss and Fleming, the fine folks there, or you can download it off of the agent website once you are appointed, and just kind of get it down into your spirit on what the plan does and what it doesn't do. The benefits of the plan, the basic benefits, the rider, prescription drug, and so on and so forth. On page 4, I'm checking here, guarantee renewability for life as long as the plan premiums are made by the insured or whoever the payor is. But one thing I want to bring out, and it's very, very important, is that you make known to the client of what this plan is and what it is not. It's not an MA plan or a Med Sup plan or long-term care. This is a short-term, 1-year home health care standalone benefit. That's what it is. So please just make sure that your client has a thorough understanding of what it is and the power of the plan. You see me circling right here in red on page 4, and it's a place for signatures. So it's a place for you to have, you've got to sign it as the agent, and then also the insured, the applicant needs to sign it. So make sure that you leave a copy of the OLC with the client and that you have a copy with all the wet signatures so that it accompanies the application. Now, before I leave this slide, I'm going to circle one other thing, and it's on page 2, and you'll see a place for an initial. In the event that the client purchases the rider, because there's a cost to the rider, it needs to be initialed. So it needs to be initialed and sent in with the rest of the OLC. Okay, let's go to the next slide, and this is kind of talking about the basic benefits, the home health care indemnity benefit itself. Let's look at the first bullet, that once triggers are met, it will reimburse up to $150 a day in the state of Pennsylvania for 360 days. Well, that's a $54,000 max benefit potential here on the basic benefit. Now, look at that second bullet. Let me kind of paraphrase it, just let you know. This is an indemnity benefit. So regardless of any other plan that your client may have, this pays over and above. It doesn't matter if on the other benefit or if they have other plans through a group plan or Medico or long-term care or Med Sup or whatever it may be. This pays over and above anything else that they may have. Also under the basic plan, there's a home health care aid indemnity benefit. Let me read this, okay? We will pay, which is Reserve National, subject to the policy provisions and limitations, a daily benefit of $40 for each day. That's a 60-day maximum that the insured requires the services of a home health care aide immediately following a hospital confinement of not less than 3 days. So let's multiply that. 60 times 40, there's another $2,400 maximum benefit. So let's don't stop there in Pennsylvania. We have a home hospice service indemnity benefit. This is where a $50 daily benefit per day for 180 days. That's another $9,000 benefit that could be paid to the insured if they meet the triggers on the hospice service. That's got to be signed off by a physician, which we're going to get to the form near the end of the broadcast. Now, let's look at this. When you look at the basic benefit, what is covered? A benefit is paid each day that the insured receives the following services in their home from an approved home health care practitioner, up to the daily maximum benefit of $150. So remember that, up to a daily maximum benefit of $150, and I want to clarify something before I leave this slide. But let's look at what it covers. It covers up to $50 a day for intraosseous therapy and respiration therapy. Intraosseous therapy is stomach issues. Also, $60 a day for general nursing care. That's through an LPN or an LVN. Chemotherapy specialist services. There's $75 a day, and there's 4 choices there. Skilled nursing care through an RN, physical therapy, speech pathology, and then also occupational therapy. Lastly, $100 a day for medical social services. Now, before I leave this slide, remember I kind of emphasize up to a daily maximum benefit of $150 a day. Let me give you an example. This is an aggregate. So let's just say, for an example, that the insured qualifies for the medical social services reimbursement of $100 a day and respiration therapy of $50 a day. Even if they had all the other events, they're only going to be reimbursed a max, so it's an aggregate. It's not going to be all of those. It's any combination of up to $150 a day. So I want to mention that before I left this slide. Now, let's look at the prescription drug benefit, which is a part of the basic plan. You see me circling in the lower left-hand corner. These are actual receipts of a client that is enrolled with us. I've circled the retail amount, which the client can get from a pharmacist. They just got to ask for receipt for the retail amount. Okay, you're going to see a summation over there to the right. And as you see, the total gross is $373.97 of those 3 prescriptions. In Pennsylvania, they can get reimbursed up to $25 per prescription drug per policy year. So in this example, 3 times 25 is $75. So really, if they get reimbursed $75, the net cost on these prescriptions is $298.97. It's a savings of $75. Now, I want to mention something on this next slide, and I want to read this to you just for clarification and also the power of this prescription drug benefit in Pennsylvania. This is actually a cutout that I've got here in yellow from the OLC, the prescription drug indemnity benefit. If the insured purchases a prescription drug as the result of injury or sickness, we will pay $25 for each such prescription drug, limited to a maximum aggregate prescription drug indemnity benefit of $300 for all prescription drugs in a policy year. That's a mouthful, isn't it? Well, here's what it comes down to. The insured can have up to 12 prescription drugs and get reimbursed $25 per policy year on them. That equals $300. So now, and see, you and I both will know this, that being in this industry, that a lot of people are more than 3 or 4 or 5 prescriptions. I mean, that's how it is. So in the plan itself, you can see that on the prescription drug benefit in Pennsylvania, and there's no deductible that needs to be met, that they're going to be reimbursed up to this amount, as I stated. So let's look at an example here, a sample actual premium in Pennsylvania, and this is their ages 65 to 70, that the actual premium for the basic plan is $232.95. That's annually. And if you take out the prior example of $75 per prescription drug, the effective yearly expense is what? $157.95 a year, which is $13.60 a month. So you can see that there is power in the prescription drug. Imagine it like this, and as before we go to the premiums, that under the basic plan, the client has 2 buckets. They have a bucket with home health care basic benefits and another bucket That includes the prescription drug benefit. Buckets don't seep over to one another. They have their own bucket. So what does it cost for the client? This is the actual premium for Pennsylvania. So as you see here, and I'm circling age 41 to 55, it's the same premium, $13.20 a month, which is $158.40 annually. That's a gross amount, which equals $44 per day before there's any reimbursement at all. The example premium that I gave was 65 to 70, wasn't it? $19.40 a month, $232.95 annually, 65 cents a day is what it would cost someone in the age bracket of 65 to 70. Now, before I leave this slide, if you haven't had this question, you're going to have it. So let me answer it right now. Jack, are you saying, or does the client retain the same premium for the life of the plan? No. Look at age 51 to 55. It's $13.20, isn't it? When they get into the next 5-year grade, 56 to 60, it goes up to $13.95 a month. That's an increase of 75 cents. And then from age 61 to 64, it goes up to $18.50. So you can see it kind of goes up about another $4.50 or whatever that is. So because they're getting older, and by all probabilities they're using the plan, it is going to increase every 5 years after age 55 on the basic plan. And because of room, it still goes up from age 86 to 90. It just stops in the way of 81 to 85 at 46.30. So it goes up a little bit more from age 86 to 90. So I want to mention that as well. Okay, let's go to this. Now we're going to talk about the optional benefit rider. And we've moved about 18 minutes into the presentation, so we're right on track. The optional benefit rider. What does the client get? There's an annual physical exam. This goes into effect 12 months after the rider's effective date, and this is where the client will be reimbursed up to $150 per policy year for an annual physical exam. And it's limited to one physical. I've mentioned that a little bit, one physical per year. There's a vision benefit. This benefit goes into effect 6 months after the rider's effective date. On a vision benefit examination, that $40 will be reimbursed. There's also $75 reimbursed on lenses and frames, and that is also 6 months after the rider's effective date. A hearing benefit. On the examination, the benefit will be reimbursed up to $50 on a hearing exam, and that rider takes effect 12 months after the rider's effective date. There's a hearing aid reimbursement up to $250. That also goes into effect 12 months after the rider's effective date. There's an ambulance benefit, and it's $100 per trip from the home to the hospital, $100 back, $100 from the hospital back to the home, $200 max in any 12-month period. Lastly, there's an in-hospital private duty nurse benefit where $80 per day will be reimbursed up to 30 days. That's another $2,400 potential reimbursement to the insured. One thing that I would like to mention is that this benefit is not payable to any member of the insured's immediate family if they are a nurse. Okay? Now, let's go on to the buckets. Remember I talked about the buckets under the basic plan. Well, what's it look like? What's the buckets look like if they have the optional benefit? Well, they have 3 buckets. They have the home health care basic benefit bucket. They have the prescription drug plan bucket and the home health care optional benefit buckets. So, and that's only a visual. So that not only can you understand, but you can kind of explain it to your client as well. What's the premium? It's not this plus the other slide that I showed you on the basic plan. This is the premium in totality. So from age 41 to 50, you have the same premium, don't you? It is $19 per month, $228 annually, or 63 cents per day. At age 65 to 70, we used that example a while ago, $25.35 monthly, $304.15 annually, 85 cents per day. Like the other slide I mentioned, that is a 5-year grade. So every 5-year increments, it goes up a little bit, as I mentioned earlier. Okay, policy triggers. We kind of used that terminology a while ago, triggers. What triggers benefits to be paid out to the insured? It's where the physician says that the insured cannot perform 2 or more of the 6 ADLs. What are the 6 activities of daily living? It's eating, bathing, dressing, toileting, transferring, continence. Or if they have a cognitive impairment such as Alzheimer's or dementia. We're going to talk a little bit, let's take about 45 seconds about restoration of benefits. There is a restoration of benefits where all the benefits will be restored on the home health care aid indemnity benefit, provided that the insured does not receive or require the services of an approved home health care practitioner or a home health care aide for a period of 180 days. So it's not that the insured says, I do not need it. The physician's got to say they do not need it. So for 180 days, that is 6 months. Now, this provision does not apply to the home health care indemnity benefit or the home hospice services indemnity benefit in the state of Pennsylvania. There's no limit for the number of times that the maximum benefit period can be restored in a covered person's lifetime. All right, we are moving right along through this presentation, 22 minutes into it, and now we're at the application. Let's talk about that for about 4 or 5 minutes, and we'll be coming quickly to a close here. Pennsylvania. Let's look at the app. There are 2 types of apps. You have the Guarantee Issue Life app, and you have the Home Healthcare application. You can see I'm circling right here where it says Application for Supplemental Home Health Care. So make sure that you're using the right app, and then also in the lower left-hand corner that you can see there's a form number for because it's state-specific. For most states, it requires that application for that particular state where the insured resides. Okay? And you can see over in the right-hand corner, page 1 of 2. So what's that telling you? There's 2 pages to this application. You have the front, you have the back. You have page 1, you have page 2. That's it. This is the application. And let me mention something before I leave this slide. The app is a product is approved and issued off the application. There is no MIB, there's not an APS, there's not a pre-script check, there's nothing. This thing is issued right on this application, so please make sure that you're very thorough with your client, they understand what they're purchasing, that everything is signed and all forms are completed and sent in with the application initially so it can be approved. There's one thing that really holds up issuing of policies or declinations, and that's incomplete packets. Okay, let's look at the application a little closer. What does it look like? And as you see, I'm circling right here, applicant. This is just the applicant's information, their name, their gender, where they live, their date of birth, their social, and things of that nature. Another part of the application, this is the underwriting portion. There are 5 questions to this application in Pennsylvania. This is it. You've got questions 1, 2, 3, 4, and 5. Number 1, it's just asking a question. Do they have any other coverage? It's yes or no. It's not a knockout. It's just a question. Let me go all the way down to number 5. Do you acknowledge receipt of the outline of coverage for this policy? Remember, it's very, very important, and I mentioned it several times, that on the OLC that you leave a copy of the OLC with the client and that they've got a good understanding of what they're purchasing. That's why they're asking this question. So if the insured acknowledges that they have not received a policy, it's not going to get issued. So just make sure that that's a yes and that you leave a copy of the OLC with the client, and a copy with a wet signature accompanies the application when you send it in. But let me look at question number 2, 3, and 4. Very important. If you look at these questions right here, and I've circled them, if they answer yes to any of these questions, they're not going to get approved a policy. Number 1 talks about replacement. We're not going to be replacing anything else that they have. If they want to cancel something that they have, that's their prerogative. They can cancel whatever they want, but we're not using this. It will not be issued for this policy to be issued to replace anything else that they have. A lot of companies take that attitude. Question number 3, are they currently in a nursing home or an assisted living facility or currently receiving home health care or similar type benefits. If they are, that means they're on claim. So we're not going to be issuing a policy if someone's on claim or living in a facility. Fourthly, are they able to perform the 6 ADLs? If they're not, well, that means that they're going to go on claim fast, doesn't it? So here's what it comes down to. If they answer yes to questions 2, 3, or 4, stop. It's not going to be issued, okay? Payment mode. There's 2 ways that they can pay for this. They can pay for it annually or monthly. Monthly is either bank draft or savings account draft. There's no credit cards. There's no express cards. We do not bill monthly, quarterly, or semi-annually. So annual or monthly, and monthly can be either by bank draft or savings account draft. And you see how here now you got is it the base policy? What's the premium? The base policy and extra benefit rider and premium. They're going to have a figure in one of those 2 premium slots. One of the 2, not necessarily both. Now, let's look at this. This is agreements and signatures. This is kind of continued, a part of the application. The date of application, kind of self-explanatory. That can only be selected when paying annually. The date of issue, that's determined by the home office. When you look at other, now this is interesting. If you check other, the client you can literally send in the application and all the other forms without remitting a premium. You can literally set it up to where the client's first month's premium can be deducted out of their checking or savings account. Now, don't go out more than 30 days, but they do have that prerogative. The last thing I want to talk about, policy to be delivered to. You can elect where the policy comes to you and you deliver the policy to the client, or you can have the policy sent from the home office straight to the client. Totally up to you. Just let them know where you want the policy to go. The last thing I want to talk about here is that there may be someone that signs for the insured other than the insured themselves. If there is, let's say that it's a son or a daughter or a spouse or whoever it may be, the power of attorney paperwork must accompany the application. So if there's a signature other than a proposed insured, make sure that the power of attorney paperwork accompanies the application. Continuing on the next slide. This is the bank draft information. Whoever's paying for this, that's who fill this out. And it's their bank name, the routing number, the account number. Is it checking? Is it savings? Their signature, the date of the application. Is it an annual payment or monthly? Additional tips. The policyholder's legal residence is where they reside. No remittance is needed with a monthly. I kind of mentioned that earlier. Do not select the date of application on a monthly. And on the bank draft authorization, it should always be completed even on collected annuals, and it's primarily for renewals. Last thing I want to cover on this page, and I circled it in red, the company will hold on to incomplete applications for up to 60 days, waiting for signatures, incomplete forms, or whatever it may be. Just try to make sure that when you do send it in that you're very thorough. You got all the signatures and documents or whatever it may be when you send the application in. Okay, what's going to accompany a packet? Well, you're going to have a fax cover sheet or a cover sheet. And on the cover sheet itself, it will just let you, the agent, you can put other comments in here or how many pages are attached to you want it to go to, so on and so forth. So you have a fax cover sheet. And then you have the signatures that's on the OLC. So you have the outline of coverage, you have the application, and you have all the signatures and everything filled out. And then you have the medical notice that needs to be signed by you and the insured. That kind of completes a packet, that is needed to get a policy approved for a client. Now let's take a look at a couple of other standard forms. We're moving through this presentation quite rapidly. We'll be done in probably about 5 minutes. So here, the physician's home health certification and standard claim form. These forms here are out on the agent website. Go to the, once you are appointed and you've registered, you can go out on the website and you go to the resource tab and you can get all these forms I'm going to be talking about here. First is the physician's home health certification. This is filled out by the physician. You can make copies of these, keep them in your portfolio, in your briefcase or wherever it may be, and show the client what it's going to look like when they get ready to submit a claim or whatever it may be. In fact, you can give them a copy of this. And here's where the physician signs it and date. This is what triggers the claim payments. And then you have the standard claim form, the attending physician's report. This is not only filled out by the physician, as you see there where they need to sign it in red, but also the insured where they've got to sign it and date it as well. Next slide here, the home health care state variations. This is a pretty cool form. As you see right here, this is we're talking about Pennsylvania. This is out on the resource tab as well. If you sell in Pennsylvania, you could sell in Ohio, Kentucky, wherever the product is approved. And it's a snapshot, kind of a bird's eye view, if you will, of what the plan looks like from state to state, because it does vary. Like, for example, some have 360, some have 365 days. Some have the home health care aid that's 3 days and some 0 days. On the max benefit period for home health care aid benefit, some are 60 days and some are none. I mean, it's all 60 days, but wherever it's like, for example, in Texas, it doesn't even have it. If you look at the prescription drug benefit, it's going to vary from state to state. There are some variations there. Nice piece of information for you to keep with you. Okay, the supply form. This right here, you can get this out on the agent website under Resource tab as well. This is where you order your supplies. And you can either fax it in or you can scan it in and email it in to contracting. This is where you get your supplies ordered. Let me mention this. Don't order hundreds of anything. They're not going to do that. If you're an agent with an agency, you may get more than the producing agent. So just try to be mindful of supplies because they cost a lot of money and we're taking down a bunch of trees. So just try to order what you are needing. And you can see this has been updated on December 1st, so it's kind of up to date. Frequently asked questions. I have 3 slides left. This is kind of important, and here again, this is out there on the agent website under resources. Some of the frequently asked questions that clients may have. And what are some of the questions? What is an agent supposed to do with the outline of coverage? I mentioned that to you. Leave a copy with the client, and a copy goes in with a wet signature to the home office. What is an agent supposed to do with the important notice form, home health care med notice, SS? Well, that is supposed to be signed by the insured, you, and send it in with your packet. Can an individual have more than one home health care policy? The answer is no. They can only have one at this time. Is a prescription drug benefit included in all home health care policies, even though in most state policies it is shown as a rider? Yes, it's part of the basic plan. It falls under the writing term because of state verbiage, so it is a part of the basic plan. There's no other cost over and above what the premium that I reflected on earlier slides. On page 2, not that much going on page 2, but on page 3, what I'd like to talk about is there an approval list or process. There is no approval list or pre-approval process. An insured must meet the requirements of the policy and complete and submit the physician certification form. So you see 2 slides back, I kind of went over that. That's why it's important that you kind of have some copies of this stuff with you, and you can leave it with a client for future claims. Do premiums increase with insured's increased age? I mentioned that. Yes, it does, depending on what plan they purchase, whether it be the basic or the basic with the riders. It increases every 5-year increment as they grow older, as I outlined. And it's outlined also in the brochure. Okay, where's this product approved and where it isn't? You can see in a copy of the country that it's approved in the vast majority of the country. It'd be easy to say where it isn't. We haven't filed in Florida and California and Minnesota and some New England states. However, it is pending in Washington and Oregon, Wisconsin, and some of the New England states. So just get a hold of the Nischloss and Fleming folks. They'll let you know exactly where it's approved, where it isn't approved, and where it's pending. Okay, we have talked about the home health care plan. It would be remiss of me not to talk about the GI product. That's our life plan. And what does it look like? I mean, it's even simpler than the home health care plan. It's for ages 40 to 80. Also, coverage is from $5,000 to $25,000. Smokers pay no more premium than non-smokers. There's absolutely no health questions. The policy can never be canceled once it's approved. Rates never increase, and benefits never decrease. So it's a very, very strong product for those. Here's who that product is primarily designed for. It's designed for those that have severe health issues or can't get coverage at all. If a person, and I don't mean to be flippant about it, but if a person can fog a mirror, they're going to be issued a product, provided that they are between the ages of 40 to 80. All right. You may have questions or comments. You may would like to receive a copy of this PowerPoint presentation that I'm recording. I will be sending a link to the Niche Schloss and Fleming folks. They can email it to you, and you can listen to it at any time and share it with any of the agents or your downline or whoever it may be. But any questions or comments, you can contact Niche Schloss and Fleming, Inc., Life Insurance Division at 1-800-562-7733. That's 1-800-562-7733. Get a hold of Jeff Bickmore. He's at extension 118, or Aaron Cozy at extension 133. If you want to email them information, lifedivision@nischloss.com. That's lifedivision at NEISHLOSS.com. My name's Jack Broughton. I thank you so much for being a part of today's PowerPoint presentation. I always like to be graded on my performance. Did it come across clear and concise? What did you think about the delivery, the facts, the figures, the logic, how it was delivered? I can take constructive criticism. Please don't throw stones too hard. But just kind of let me know. So, Jack, would you emphasize this a little bit more? It might be helpful. Or slow down. Or do this or that. I mean, I'm always open for suggestions. That's the only way I'm going to know. I also like to know if it came across clear. If you thought it was a quality presentation, I always invite any comments that you have. You can email me at jbroughton, JBROUGHTON @Kemper.com. jbroughton@Kemper.com. I appreciate it, and this kind of concludes today's PowerPoint presentation. We moved quite rapidly, but I think we got a lot accomplished. 38 minutes into the presentation. I thank you so much for your time. Have a great Tuesday, and let's have a great 2015.